Louise Upston.
Thank you, Mr Speaker. I'm very pleased to be the final speaker on this debate on the health inquiry. And as my colleagues from across the House have done so, I want to commend my National Party colleague, Dr Paul Hutchison, for leading this very significant piece of work. Like my parliamentary colleagues in the House today, I do recognise, Mr Speaker, that this will be a legacy piece of work. The government, of course, will be officially responding, but I think it's a very comprehensive piece of work that has looked at the most critical years of a child's life. Mr Speaker, we in this House all know that every single baby and child of New Zealand is precious, and we need to do whatever we can to protect them and make sure that they have the best opportunities as they grow up. I think one of the things that has been successful in the work that we are doing in government now is to continue and increase the investment in health overall. And if you look at other countries with economic conditions, some have struggled to kind of keep up their investment. So I think it's important that we continue to do that and to make sure that that spending is focused in exactly the areas that count. My colleague, Louisa Wall, talked about the fact that many of our pregnancies aren't planned. And if we think about what I consider parenthood being the most important job on the planet, and so many of our young New Zealanders aren't planning that particular role, and so I think the children that are born into those families need more support than they do currently. And this was a common theme that came up when I was a member of the Māori Affairs Select Committee and the inquiry into the determinants of wellbeing for Māori children. So there are a number of recommendations in the report that look at the whole concept of contraception, of education, about making sure that unwanted pregnancies can be prevented in the first place, and that we support those with planned pregnancies. And it was interesting that my colleague Louisa referred to the recommendations in the report specifically around that early pregnancy intervention, because that also, Mr Speaker, is what I wanted to highlight from Counties Manukau, because if you look at an example of New Zealand, in Counties Manukau, less than 16% of pregnancies had an antenatal check before 8 weeks. If you look at the equivalent in Sweden, it is 90%. And so you're kind of getting a double hit, because some of those women that are presenting in Counties Manukau will be of Pacific Island descent, and unfortunately the statistic there is 86% of those are overweight or obese. So before that baby is even born, there are additional risks presenting from a health perspective for things like gestational diabetes, which then presents a lifelong challenge. So the more opportunity, Mr Speaker, that we have to intervene early, the more we should look at that. And the fantastic thing about those early antenatal checks is then, through a range of different agencies and groups working with mums and families, other potential risks are able to be identified. And so with programs like Whānau Ora and some of the other work that we're doing interagency, we're able to make sure that the services are wrapped around that mum and family before baby arrives. And I think that is one of the most important things we can do. It very much mirrors the work that Paula Bennett is doing in the vulnerable children space. So it actually joins up a lot of the government's work at the moment and looks more specifically at some of these areas. And that antenatal area, for example, getting more of our mums presenting earlier in their pregnancies, is one very simple thing that this report highlights that would make a significant difference. Mr Speaker, I'm very clear, and I want to quote the Prime Minister in closing this debate today, when he says the basis of a country is not its government but its families. And I think that is a very true note, and I want to close my address today by wishing every New Zealand child and family and my parliamentary colleagues the best of the season's greetings.
Members, this debate is concluded. The question is that the motion be agreed to. Those of that opinion will say aye. To the contrary, no. The ayes have it. Members, the House stands adjourned until 2 p.m. today.